and a very warm welcome to Thorough News Analysis, which is presented to you by LawSikho. Let's have a look at the news items we have today. The first is Pandemic Resilience. It is about the report of Parliamentary Standing Committee for a Comprehensive Public Health Act. The second article we have today to discuss is Put the Farm Laws on Hold, Uphold Farmers' Right. This article talks about the new farm laws and the rights of the farmers. This article, A Blind Eye to Justice, is also a related article to this article. Thirdly, we have some news item in flash which is important for prelims purpose. If you are preparing for judiciary service examinations, you can go through our courses and also download free study material from this. Also, you can download the PDF of these slides in the description below. Let's have a look at the MCQ question of the day. What is the theme of 6th India International Science Festival? Option A, Science for All. Option B, Science for Self-Resilient India and Global Welfare. Option C, Science and Sustainable Development. Option D, none of the above. You can write your answers in the comment section. Let's have a look at the descriptive question of the day. Discuss the legislative reforms needed for strengthening India's public health system. You can write your answers in 250 to 300 words. So the first article of the day regarding the Public Health Act. Why it is in news? Recently, the Parliamentary Standing Committee has come up with a report which talks about the Comprehensive Public Health Act which is to be introduced in the recent future because the vulnerabilities of the Indian medical system has been exposed and it has pushed the government to think about the public health system in India. The major concerns in Indian public health system are: firstly, there are 0.55 government hospital beds per 1000 people. That is, there is not even one government hospital bed for 1000 people in our country, which makes it overstressed, and therefore people tend to go to private hospitals when they get ill and they are charged heavily. And sometimes the poor people also are not aware of the insurance policies, they don't have insurance and they are drained of all their money in a single medical issue. Secondly, there is a prolonged underinvestment in public healthcare system. As we know, government is dedicating only 1.2% of the GDP to public health system, which is very low for a huge country like India. And therefore, because of this prolonged policy of underinvestment in public healthcare system, it makes the public healthcare system more vulnerable. Therefore, it has left millions to seek help from private sector, and the situation is also worse in rural areas where there is not even more penetration of private sectors. Thirdly, there is inadequate legal framework to curb profiteering during crisis and provide robust cashless health insurance. As we know that during this COVID era, during this pandemic, there has been skyrocketing prices charged by the private agencies and the hospitals from the patients, and there has been no legal framework to curb this profiteering by the private entities. Also, as right to health is covered under Article 21 of the Constitution. However, because of inadequate legal framework, India has not been able to achieve the right of health to each and every citizen of the country. Also, it is seen that there is rise in premium during this COVID era, and it has exceeded the principal amount. The premium has basically exceeded the premium amount, which makes the payer very difficult to pay the premium for health insurance coverage. Also, the IRDAI kept the maximum age for health insurance is 65 years, which keeps many people out of the bracket of health insurance. Now let's have the look at the data. India has world highest death of mother and children till date, and maternal mortality rate, that is MMR, is highest of all the countries, and infant mortality rate, that is IMR, also continues to be the highest in the world in India itself because of inadequate public health facility. Also, in India, 47% of the children under 5 are malnutrition, which is highest in the world. Now let's have a look at the steps needed. The author recommends here that government need to be the sole and single payer to care providers, and it should be the tax funded system which should regulate the care providers, and the central government should be the only procurement agency which will procure the essential drugs, and then it can distribute freely or in a lesser cost to the poor people. Thirdly, it recommends that legal reforms has to be made and a time-bound transition should be decided in which states shall provide all the health services under a right-based and non-exclusive. Also, it is recommended that the government should increase its contribution to public health system, that is to 2.5% of GDP. Right? The second article for the day is regarding the farm laws. Recently, the Supreme Court has recognized the constitutional rights of farmers to protest as long as it is non-violent. Also, Supreme Court has recently suggested the central government to form a joint panel to look into the demands of agitating farmers. Let's have a look at the concerns and demands regarding the farm laws. There has been many changes made to the Essential Commodity Act. Also, there has been uh, changes regarding the corporation and mechanization of farming and introduction of corporate farming in India. So, the concerns regarding them are basically that this law will enable private entities to control and monopolize the market, and the farmers will not get their entitled due of the MSP price. Also, the mechanization and corporation of agriculture will limit the marginal farmer to practice agriculture. Also, the mechanization and corporatization of agricultural is seen as a threat here, as many farmers in India are marginal farmers. They do not have a land more than 2 hectares. They are marginal farmers, so they cannot implement and compete with the corporates if they don't give their land to these big corporates, and they will fall out in the race. So even they are not so skilled that they can compete with these entities, like big farmers and the corporate entities. So their survival and the workforce they work cut, so their survival is a question. So their survival is a very important question which is asked by the farmers representative here, and it is a concern. The demand they put is that there should be a total repeal of the new laws. The first concern is that the private entities will be able to control and monopolize the market, and they will not be able to sell their products at a fair price in the market as they used to do in a regulated mandi system. Mechanization and corporatization of agriculture will lead to survival threats to the marginal farmers, as there are huge number of marginal farmers in our country who have a land of less than 2 hectares. So the demands by the farmers is that there should be a total repeal of the new laws, and the government should make MSP as a legal right. So the action required in this is that there should be a hold on new farm laws, and it also recommends that to initiate widespread, transparent, and participative consultation with all the stakeholders, then only the government should take any decision. PM to launch Sehat. So the Pradhan Mantri Narendra Modi will launch Sehat scheme under the Pradhan Mantri Jan Arogya Yojna for all the residents of Jammu and Kashmir, and it is basically a health insurance scheme in which the all inhabitants of Union Territory will receive free cashless health cover up to 5 lakhs. So this was all for today. Thank you.